Here is an important question. Can there be too much adjusting? The answer is it depends. So let's look at two important variables. We have to look at the force of the adjustment, and we also have to look at the person that is receiving or getting the adjustment. So we're going to look at all these variables and see where can there be too much adjusting. So here we go. So because adjustments can be gentle or much firmer, those are things we need to consider, but we also need to consider if the person has stable joints or unstable joints. So let's look at this. If you're getting a gentle adjustment, say in the form of immobilization on a stable spine, then can there be too much adjusting? And the answer is typically no. Okay? Now, we're going to look at the next one. Can we have, with a firm adjustment on a stable joint, can there be too much adjusting? And the answer is likely not. Now, we don't know, but I would say it's probably very uncommon, so that is not something we worry too much about. So now we want to get into where we're looking at the unstable person. So the question now is, how about gentle adjusting on an unstable joint, right? Can there be too much adjusting? And the answer to that is maybe, right? Likely not, or maybe. Do we know? No. But these are things that we have to be aware of and cautious. But that brings me to the last thing, which firm adjusting on an unstable joint. So if a person has joint instability, can there be too much adjusting with firm, say what we call a traditional high velocity, low amplitude adjustment? Can there be too much adjusting with a firm adjustment on an unstable spine? And the answer is yes. Now, how do I know this? It's because I have seen this firsthand with patients of mine with instability that have come in, and after becoming stable and revisiting adjustments for maintenance or wellness care, which is absolutely fine, and the other factors that we discussed, but unfortunately for a few people that I have seen, that unwound what we made stable to become unstable. So yes, is it every person? No, but there is that risk. Can there be too much adjusting? And the answer for firm adjusting with instability, it can make it more unstable. So this is why it's super important for these variables here. This is why practitioners must understand instability to identify, depending on the type of force they do with adjusting, is the person stable or unstable? How do we know? What is the indication? What should we be looking for? This is why I teach professionals to understand instability, because sometimes it is a contraindication. Not all the time, but sometimes it is. Now, if you are a person that is unstable and you say, maybe I've had a negative response or anything of that likeness, I'm going to remind you, you cannot do what a stable person does. I have joint instability. I have a history of many things. But this is where a person that is unstable does not do so well with firm adjusting, deep massage, various things that make us more unstable. We are always trying with treatment to move more towards stability, and there are certain things that do that. We want to stabilize, not destabilize what's going on. So now we talk about what is the risk. So what is the risk? Can there be too much adjusting? And what is the risk? That is making this person that has instability more unstable. I have seen it. I have seen people that I have stabilized become more unstable, and that is the risk. But what we know about instability is there's a lot of neurological symptoms. It is a neurological condition, especially when it's spinal instability, and that is very important. So now I've answered the question, can there be too much adjusting? So it is important for you to know if you don't do very well, you need to address your instability.